Hi, my name is Jorie Green and I am a senior here at Wheaton College. My future plans are to become a nurse practitioner and attend Rush University in the near future. My internship location was MarianJoy Rehabilitation Hospital here in Wheaton, located on Roosevelt Road about 7 miles away. My internship lasted from fall 2010 to spring 2011. During the fall I was in about 5 days a week, while during the spring I was only able to go into twice a week due to course load. I chose this internship at a hospital due to the fact I was still trying to figure out what kind of career I wanted to pursue in medicine, and thought that a hospital would provide the most examples and the most shadowing opportunities. My internship supervisors were Joe Lang and Jim Decker, amazing people who ran the volunteer department and organized a wonderful internship for me. I was also under the surveillance of Mary Frost in the dietary department when I assisted there. My duties involved helping Mary Frost in the dietary department with patient surveys, doing patient menus. I was the only one for a while providing them with information on how the patients were responding to the meals and the food and their time there at MarianJoy, and I would spend about 5 minutes surveying each patient and going around to each of the 3 floors, and it was a very rewarding experience because MarianJoy doesn't believe in just doing your job and leaving, but in talking with the patients and getting to know them better. The majority of my time at MarianJoy, however, was spent doing patient transportation. Each patient has 3 hours of therapy, going from therapists, speech therapists, OTs, PTs, doctors, nurses, and they all have to be taken there. And transporters get them in and out of bed, get them to the nurses and back, get them to the therapies and back, and I was daily in charge of an entire wing of one of the floors under the head transporter. This was a wonderful time to get to know patients and to really find out that I really do enjoy working with them at the different stages of life that they're in. I was also able to shadow the doctors and nurses at MarianJoy. MarianJoy is organized with 3 floors, each with separate wings holding different patients with different patient care needs. From spinal injury floor to brain injury floor to pediatrics, to just basic knee replacement therapy issues. I was able to follow all the head nurses and doctors in those departments and really get to see how they daily work in these kind of environments. It was extremely rewarding, and they were wonderful to let me spend all day with them. My favorite time at MarianJoy, however, was the month I spent in the pediatric department. I would daily go up there for a little while to help out with the young children that they seem to be overwhelmed with at the moment, who had health needs, and help the OTs and the PTs. However, a little girl came in from a children's home. She was an orphan and she was 3 years old, but had the mental capacity of about a 9-month-old. She had a trach implemented that she kept trying to pull out and had almost killed herself 3 times, and she needed constant surveillance, a thing that the nurses were hard-pressed to do during the busy day when they're helping with other patients. Maybe this was a bit outside of my comfort zone or skill area. A nurse was always right outside at the door. However, I got to really work with her personally. I got to work with this little girl, play with her, help the OT and the PT with her, make sure she didn't hurt herself anymore. And it just was a really rewarding experience to be stretched like that. My whole time at MarianJoy was a blessing. MarianJoy and the people there were very loving and very eager to give me the best experience there, and we really worked well together. My excitement and enthusiasm for the medical field has only increased from my time spent there, because they showed me that I can work well with patients, I can work well with people in the medical profession, and I just need to go get the education to make that a part of my future and my reality. Thanks very much. I will send you a PowerPoint presentation because I didn't know how to do this with the video. Thanks so much. Bye.